Hello, are you ready to learn some tips on how to ace your NCLEX exam? If you are, then please continue to review. Hello, I am Dr. Rashay, also known as Dr. R. And today what I'd like to do is just review how to read the NCLEX type questions. There are quite a few steps, believe it or not, when it comes to reading the questions and to make sure that you're picking out the keywords and everything like that. So I would just like to briefly show you how I teach and how to do these things. Okay, so let's start with, we have our first question here. The first question we start out with is, a nurse is caring for a patient with chronic obstructive pulmonary disease, COPD. Which of the following interventions is most likely to improve this patient's breathing? All right, so we did step one, which is read the question. Step number two, we're going to go back and start picking out keywords. So what are some of our keywords? Well, we have nurse, doing what? Caring for a patient. And right here we have this huge keyword right here, chronic obstructive pulmonary disease. And then which of the following interventions, huge keyword here, is the most likely to improve the patient's breathing? Now, a lot of times when you're going through and you're looking for the keywords in the next step, when you first learn this process, you're going to be like, I don't understand why some of these are keywords. But the biggest thing we're looking at right now is we have a diagnosis of COPD. So the first step, go through, read the questions. Second step, go through, pick out the key words. Now the next step is we're going to kind of come down here, start looking at our answer choices. Just read them all just to get an idea of what's there. A is to encourage the patient to drink large amounts of fluid to thin respiratory secretions. Second one is instruct the patient to use pursed lip breathing during periods of dyspnea. C, advise the patient to increase their oxygen flow rate to help maintain oxygen saturation. D, encourage the patient to lie flat to reduce the work of breathing. All right. So go ahead and take a look at these and just take a guess on which one you think that this answer is going to be. I'm going to tell you it's going to be this one here. Instruct the patient to use pursed lips breathing during periods of dyspnea. Okay, why? Let's look at the rationale. Pursed lips breathing is a technique that helps patients with COPD improve their breathing by slowing down the respiratory rate and preventing airway collapse. The key words, especially with that question, if you look at it, what is the question actually asking you? It wants to know, what can the patient do to improve their breathing? Out of all those selections, that is the only one that we have that assists in helping with the breathing. Makes sense? All right, let's look at question number 2. Step 1, read the question. A nurse is monitoring a patient's cardiac rhythm and observes a pattern of irregular heartbeats with consistent PR intervals and intermittent missing QRS complexes. This type of heart dysrhythmia is most consistent with which of the following? Now, start looking at some of our keywords. All right, so we have a nurse. What are they doing? They're monitoring patient's cardiac rhythmia. Observe what? We have an irregular heartbeat with consistent PR intervals. Extremely key. And it's intermittently missing QRS complexes. This type of heart dysrhythmia is most consistent with which of the following? All right. So, looking at these keywords, whenever you look at everything here, the question is basically saying, give me a diagnosis. So we're going to take a look and see what our choices are. We have first degree heart block, second degree heart block type 1, winky block, or vinky back. Second degree heart block type 1. Second degree heart block type 2, Mobitz 2, and third degree heart block, which is a complete heart block. Out of these choices, what do you think this is going to be? Irregular heartbeat with consistent PR intervals and intermittent missing QRS complexes. If you guessed it being second degree heart block type 2, Mobitz 2, you are correct. Why? Second degree type 2 basically consists of, we have PR intervals that fail to conduct, and we're leading to a QRS complex, missing QRS complex. So you just have to remember there is a poem that goes out there with things. And second degree heart block type 1 means longer drop than you have a winky block. Second degree type 2 Mobitz 2. If some P's don't get through, then you have a Mobitz 2. If you're not very familiar with your heart rhythms, or you need to have just to brush up on things with that, please stay tuned. I will be having a lot of information coming when it comes to cardiac dysrhythmias and how to decipher them. If you like the video that I'm presenting currently, please click like and subscribe. Also, since this is Nurses Week, I would like for you, if you're interested in passing your NCLEX exam and need a coach, to please look at my links that I have in the description. You can go to my Facebook page, you can go to my Instagram page, and you can also go to my website. For this week only, actually I'm going to extend it for 2 weeks, so everybody has time to kind of look at everything that I'm sharing. I am giving half off of a crash course for your NCLEX exam. So if you're interested, please check that out on the website. Definitely go to the website and put in a message stating that you're interested in things, and you will need to use a code which is going to be Nurses Week 2024. Just put that in the very beginning of the message before you send me the message so that you can get your 50% off. Thank you.